Welcome to Aware and Care, your weekly prescription, Ayurveda prescription with Dr. Ambika Nair, co-founder and chief consultant at Santhigram Group of Companies. They have offices here located in the tri-state and online consultation available. Do contact the website and the numbers to reach to Dr. Ambika Nair. Every week, Dr. Ambika Nair reaches out to our audience and gives information about certain home remedies and conditions of the body that are curable, treatable from a very healthy herbal remedy process. First, let's welcome Dr. Ambika Nair. Namaskaram, Doctor. Welcome to Aware and Care.
Namaskaram.
Dr. Nair, one of the very sensitive topic. You've always been mentioning about how important it is to have good food. And of course, it's a universal mantra. Good food, good nutrition is important. Also, the excretion process of the body is also a very important process to keep the body healthy. Now, one of the most painful conditions often heard from patients and heard on magazines and health magazines and in talks, fistula. We want to understand what is fistula in ano today. What is this condition? What happens in this condition first?
Actually, fistula in ano, it is an unnatural tract formed in the body, especially in the anus. Okay. The skin around the anus, or the buttocks, it become very, like a thick also, pus formation will be there.
Okay.
So that is in the anal canal, okay, around the anal canal. So, resulted in the patients, who has complained of so many times, like abscesses. So if they don't take care, sometimes, they take care also. It can be related with the vata, pitta, kapha, or with all the three doshas also. Then, even after surgery, it comes up so many times, repeatedly it comes up.
So if I have to understand this condition in simple words, does it mean abscess or cyst near the anus?
It is not like a cyst, it's like an abscess only because pus formation. So pus formation around the anus, it comes one time. We just remove it, maybe some antibiotics are taken, it goes away. Again, if it is repeatedly coming.
Okay.
And, not only one, sometimes it will come, it will come around all the places, like so many places, which makes the life so miserable.
Okay. So this, if I have to understand in basic, and if our audience need to understand, is it very different from hemorrhoids?
Hemorrhoid is different. This is different actually.
This is different. Okay.
This is pus formation. Hemorrhoid means protrusion will be there, but it is little related also because the condition will go like that afterwards.
Okay. Now,
but pus formation will be there.
Okay. Yeah. How connected is this to IBD?
Not like that.
It's not connected.
Yeah. Yeah.
Okay. So, friends, today's episode, we're going to talk about fistula in ano and a request from one of our viewers to talk about this subject. Now, doctor, let's understand and give our information to our viewers. Is it any age specific, gender specific, or is it over gradually it happens? It is always there. It gets the ecosystem to explode. What happens?
No, actually, the people, who is sitting for a long time, and that is with the kapha related. And abscess formations, it can happen to anybody if not sitting else for a long time. Like who take a lot of spices, lot of garlic, lot of like chilies, you can see that this is all pitta related, and vata, all the dry things they eat a lot of time, like not drinking water, having constipation for a long time, even which can lead to hemorrhoids, like you said.
Okay.
Okay.
So this is any age specific or you
no.
See, but
no. Little constipation, like it can happen, because like 13, 14 and all.
That early, okay.
Yeah, some children will have, but but mostly seen in the, like the age group of like 35 to like 60. Then later on it will be dragging on.
So what is the first symptom somebody should realize that this is something very concerning?
Pain.
Oh, pain while pooping.
Yeah, pain which will not make them to sit.
Okay.
Then, like pulsating pain will be there. Then only they will understand that there is an abscess forming because little redness will be there. Then only, like some people will get little fever or some, but normally fever will not be there. like a low grade fever can be there. That's all.
Okay.
Then the abscess comes.
Uh-huh.
That's why I told you, like continuously taking antibiotics, then they go for the fistulectomy, they will be opening it up. Even afterwards, repeatedly, so many people come to me also that fistula in, so many times it comes and we take care of it very, very nicely.
Now, how difficult is this condition? I'm sure it's painful for men and women alike. But considering the anatomy of the body, have you seen cases where after post-surgery, post-delivery of babies for women, it's more difficult or it's created some kind of infection?
So many patients I have seen, not one. Mm-hmm. Even oozing will be there.
Okay.
Yeah. And so, like repeatedly it comes, even antibiotic when they stop, even months and months together they have taken antibiotics. Very smelly, even some days it will come with the urine also, even with the semen it comes out, even with the, fecal matter it comes out.
This seems to be a very, very difficult condition. And of course, we have Dr. Ambika Nair today to help us understand what this condition is. And if you're feeling any symptoms related to it, apart from finding your information, consult a doctor first. These are conditions which create a lot of issues while you're driving, talking to people, or going anywhere around. Pain is definitely one of the biggest symptoms there, apart from all the other symptoms Dr. Nair has just mentioned. Dr. Nair, if we have to get this treated, what is the process? Because it seems to be a really, as a physical discomfort, as also consulting a doctor and all the process involved, how does Ayurveda come in to help somebody who has fistula in ano?
First of all, we have to find out what is the root cause. Whether, he's following in a diet, proper diet, what is his diet, what is his constitution, what is his, that is Prakriti analysis in Ayurveda. Whether it is Pitta related, whether it is Pitta Kapha, whether it is all the three, some days only Vata related, whether his food habits, he drinks a lot, whether, intake of food is with so much of spice, sleep is good, constipation is there. We had to see the tongue diagnosis also to find out, how much amam is inside the body, color of the, the pus formation, smelly, so whether it is very purulent. So we have to see the dominance of all the, whether which dosha is more, prominent.
Okay.
Then we do accordingly.
Okay.
First of all, controlling the, pus formation. That is, we have a very good herbal remedies also, and we give the diet also. Then only, later only we do the panchakarma in these cases.
Okay. And in this kind of, after Panchakarma, are there oral medications given, or Panchakarma helps in a big way to first calm the body down and detoxify?
Definitely, Panchakarma will, 100% it will, but Madhavi, the problem with, we have to make them understand how much they help, then only we can help. That understanding has to be with the patient and the doctor.
And this aggravates more with different types of foods also, I'm guessing.
Yeah, that's what, that's what I told, it has to be very more understanding. We make them understand what they have to take, but they agree to that because the way they are suffering for even 20 years, 22 years like that, and even worst cases comes to us, very worst cases.
So are there any other organs of the body that get affected because of fistula? You have backache, or you have, leg pain?
Severe backache. Severe backache will be there.
Okay.
They cannot drive. They cannot even sit. They have to lie on their abdomen. So many cases comes to us like that.
Wow.
Frustration,
and any health
depression.
Conditions that are related to this? Any specific medications or any kind of post-surgical situation or trauma that could
post-surgical and all, we get a lot of cases, but we should not do surgery much.
Medications and heat also in the body, maybe possibly.
Yeah.
So how serious is fistula, doctor? I do understand that all the symptoms that we're talking is physically discomfort. People tend to delay treatment and say, you know what, I've taken a painkiller, I've worn an adult diaper, it's taken care of temporarily. But how serious have you seen cases where people have, it's become fatal, or, serious damages to the organs have happened?
Does even it now I have a handful of cases.
You do, okay.
And even, so many people will come and tell, we never knew that Ayurveda could do this much, a wonder in our life. So certain foods they have to avoid throughout their life.
Okay. So if you have to say that, what kind of foods should be avoided for somebody who has at least symptoms or is suffering from fistula?
Avoid constipation. Okay. And, like including turmeric in their food. There are, like if they're like sometimes, we ask them to avoid all the non-vegetarian. Because what are the foods which makes toxins, amum in the body, that has to be avoided. Then only when you do treat for the root cause, then it has to be accepted. Then only things will change. We may tell them to do only, very soft foods.
So how recurring is this problem? Because if somebody is treated, we tend to, as humans, we have this craving, we have this temptations to eat all kind of foods. Like you said, it's very important for somebody who's getting treated for fistula to maintain a very strict diet and whatever is recommended. But temptations do happen. And at any point, does it always relapse? There's a possibility of relapse.
Relapse can occur, the relapse cases only comes to me directly. Nobody will come, no? So, I always think that to make sure that what you eat, fiber has to be taken. You have to eat a lot of fiber, actually.
But doctor, this seems a little difficult for me to understand. I do understand that you said it's constipation is also a problem, but then also with fistula, people could also lose control of their system and they could have a little bit of diarrhea or they could have fecal matter in their clothes. So when you say more fiber is introduced, so they must have to go through a phase where their entire system is detoxed and then they maintain a regularity in there.
Yeah, including ghee in their food, But in certain cases, like certain fistulas are there, where the stool is also discharged. And that will be like incurable also. You understand? No, certain very, very few cases only that will be.
Okay. So friends, despite having all the processes and treatments possible, when you do not follow the strict instructions or certain guidelines by any doctor that has been given, there is a possibility of relapse. And then many a times there is a situation in extreme conditions that, it may become incurable, like many other conditions and health conditions that we've spoken here on Aware and Care. So Dr. Nair, what are the kind of foods that can calm the body, like turmeric you mentioned? What about those cruciferous vegetables?
No, that all, it all depends upon the cases actually. They can take the according to the, constitution. That's why, like if it is, like we will tell them, mostly I advise them khichdi only. Fruits are given, only cooked food we give them so that will soothe them. Avoiding drinks. Liver has to be taken care. Food has to be there. Sleep has to be seen. How nicely they are, whether they are very anxious. Because in these cases, Madhavi, they will be so much afraid because they cannot have any socially, contacts or all those things, like they cannot attend any parties. They cannot. Then, even so many people will be telling, what for we are living there. Because even 7-8 times surgery is done, they come to us.
7-8 times surgery. Dr. Nair, but when it comes to social contacts, are these people releasing any body odors or they look normal?
No, because they will be using pads and all, even, like a diaper, they will be using it.
Okay.
They can't even come, even from very far places, patients comes like this.
Okay.
But after some time, they are much better. They really, they appreciate the treatment.
Awesome. This sounds very hopeful, and it is definitely manageable and curable when you catch it at the early stage and get the right treatment process. Doctor, quickly, let's understand any control on fluids. Of course, water is a very important part of whatever we are having.
Too much, we can drink a lot of water, little, like how much they can drink, they should drink actually water.
Lemonade and buttermilk, those kind of regular.
Very good. Buttermilk is very good. Lemonade is also very good, like juices are good, but in kapha cases, some days it will make other complications. So that we tell them to avoid, Our Indian, vegetables are very good. They can always use it. Cooked vegetables. Ghee is very good. But less spice. See, any gastrointestinal issues, then you should always, even GERD, they will have so many other complications like, hyperacidity, not sleeping, not only somewhere, sometimes it can be related to some diseases also.
Okay.
Yeah, that is also there.
So in today's episode, we're talking about fistula. We went through a basic rundown about what this condition is and how it is possibly treatable, curable and manageable with an Ayurvedic form of treatment. Whichever doctor you're consulting, always remember that diet is a very important aspect for healing. And Dr. Ambika Nair has always insisted on that aspect. And Ayurveda talks and treats from the root problem. It's not only symptoms that they treat, they talk about the root cause. So this has been a capsule program for you once again. And if you have any condition that you want Dr. Ambika Nair to address here in this program, please feel free to message the number that you see on the screen and we will take it up. Thank you so much, Doctor, for today's episode. Dear viewers, please like, share and subscribe so that any episode that pops up first, you are the first person to be well informed and to share. Thank you, Dr. Nair. I look forward to the next episode with you here on Aware and Care.
Thank you so much.